Welcome everyone to this session on gestational diabetes. My name is Alison Coates. I'm a registered nurse at the local hospital and I'll be delivering this presentation today. There are 12 of you pregnant ladies listening along with your partners and other support people, so it's a big group. Firstly, congratulations on your pregnancy. For some of you, this is your first pregnancy, and for some, it's your first time having gestational diabetes, which can be pretty overwhelming and confusing. So well done on tuning in today to get some more information. You're all around the 26 to 30 week mark and have been referred by your GP after your oral glucose tolerance test. You are not here because you did anything wrong. You didn't fail at being pregnant. No one is judging you. Gestational diabetes is common, and while there are implications and sometimes complications, taking the time to learn about it and manage it really reduces these risks. We'll look at today what it means to have gestational diabetes, how it develops, what it means for you and your baby during pregnancy and birth, and potential long-term effects. Not to scare you, but just to be upfront about why it's important to manage it well. You'll probably feel better quickly when it's well managed and reduce potential complications. It's the best way to keep you and your baby healthy. We'll look at what you can do to manage it and what other things might be required as your pregnancy progresses. Usually, when we eat a meal, our body digests the food, temporarily raising our blood glucose. The more carbohydrates we eat, the higher the blood glucose. Glucose, which is sugar, can damage blood vessels, so our bodies don't want it to stay there. Also, it needs to get out of the bloodstream and into our cells so it can be used for energy. To do this, the pancreas releases insulin to help the glucose get into the cells. The amount of insulin released usually matches the amount of carbohydrates eaten, so blood glucose stays at a safe level. With diabetes, however, this works differently. Either insulin is not produced at all, such as in type 1, or not enough to move all the glucose out of the blood, leaving some behind. This is called insulin resistance, such as in type 2 diabetes. Many changes happen in pregnancy, and one is that you naturally become more insulin resistant because the hormones from the placenta stop your body responding as well to the insulin. This is your body's way of making sure that some of that glucose bypasses the mother and instead feeds the baby so it can grow and develop. Sometimes this process gets out of balance, leading to gestational diabetes. GDM is relatively common, affecting 1 in 7 pregnant women in Australia. Some things put a woman at higher risk of GDM, such as being overweight or older, your ethnicity, previously having a large baby, being a smoker, having PCOS, and some medications. The treatment is to manage it during pregnancy. There isn't a cure, but for most women it will go away after delivery. Diabetes, even temporarily like GDM, is a serious condition, so it's important to be aware and take steps to manage it. If blood sugars are too high, the baby can grow too big in utero, and there might be complications at birth or just afterwards, and the baby has more chance of developing type 2 diabetes later in life. High blood sugars are not good for the mother either, and she can feel sick and tired, have blurry vision, and it's higher risk of developing diabetes after pregnancy. Diabetics are at a higher risk of some serious complications if blood sugars stay high, such as losing vision, feeling in limbs, heart conditions, infections, slow wound healing, and other complications. Keeping blood sugar within a safe range is the best you can do to manage and prevent or delay these complications. The good news is that management begins with non-invasive activities that can help you be healthier anyway, and there's usually very good payoff between the effort you put in and the results you see. The two main controllers of healthy blood sugars for GDM women are a healthy diet and exercise. You'll also be shown how to measure and keep track of your blood glucose levels. Sometimes insulin is needed, and it's worthwhile mentioning that stress and poor sleep can raise blood sugar levels, which might seem like an uphill battle. Before we get into the details, we understand that pregnancy is hard and life doesn't stop, so you can figure out how to adjust to GDM. So just do the best you can. Every action will help. Don't worry about aiming for perfection. Ask for help and accept it. This is not being selfish, it's just looking after you and your baby. Partners and other family members can take off some of the load, and it's okay to let things go for now. Keep up with your appointments, as monitoring is really important. No one's judging you, everyone wants the best outcome for your baby. Your obstetrician may also talk to you about birth options and considerations. You've each been referred to a dietitian for a more in-depth talk about a healthy diet that fits your family. I've also emailed you some written information which you can refer to in the meantime. At the most basic level, food is made up of 3 different macronutrients: protein, fat, and carbohydrates. It's the carbohydrate component that most affects diabetes and which we most need to concentrate on. Carbohydrates are starches and sugars in food. Some are simple sugars that we know about and we should limit, such as lollies, cakes, biscuits, soft drinks, and other sweetened drinks. Sugar is also in other food which mightn't be so obvious, such as dairy foods, and starches in breads, potatoes, pasta, rice and other grains quickly turn into sugar once we eat them and raise our blood sugar. Complex carbohydrates still raise your blood sugar but do it slowly and are considered a healthy option, such as choosing whole grains over processed grains. Generally, the more processed the food is and the sweeter it tastes, the more sugar it contains. I'm not saying you can never have a piece of cake again, but rather that a balanced diet will give you more health, less risk of diabetes, and will leave room for small indulgences now and then. Try and aim for 3 main meals a day with a snack in between if you need it. Snacking constantly means you're less likely to eat a proper meal and doesn't give time for your blood sugar to come down. Pregnancy changes your appetite, how much you can eat, what you can tolerate. It's hard, we get it. Just do the best you can. Prioritise less processed foods, drink enough water, and drink in between meals. I've also emailed you a food diary which you might like to bring to your appointment with the dietitian. Here's an example meal plan. You can have a look at that one later. Exercise is a foundational management tool for gestational diabetes. You should aim for around 30 minutes most days of the week, or around 150 minutes spread out across the week, but you don't have to do it in half-hour sessions. You can do smaller chunks if that's easier. I've emailed you a list of example exercises, but really you don't need any equipment. Going for a walk after a meal counts, playing with kids counts, housework counts, walking briskly around a shopping centre counts. If you're new to exercising, start slow, build up as you go, and if you're concerned or you want to try a new exercise, maybe check with your doctor first. You'll be sent a blood glucose level monitor, a book to record your BGLs, and I've emailed an instruction sheet and a link to a YouTube video explaining how to check them, how to load the lancet, etc. It'll feel strange at first, but it'll get easier and there are options to make it less painful, so ask for help if needed. We'll help you troubleshoot. Aim to check your blood glucose before each main meal and then 2 hours after the meal. If you miss sometimes, that's okay, just take it next time. Blood glucose naturally fluctuates during the day with exercise, what you're eating, how you slept, whether you're stressed or sick or on other medications. Don't worry if you don't always hit the target range. Keep monitoring though, and if your blood glucose is higher than these targets a few days in a row, then let your doctor know. Monitoring blood glucose is really important. It gives real data your doctor can work with to help manage your GDM and have a healthy pregnancy. Also, it gives you feedback so you can adjust your diet and exercise safely. For some women, medication is needed as well, often just during the pregnancy, and knowing your blood glucose levels will help your doctor decide this. So from here, you'll be contacted about an appointment with a dietitian in the next week, and you should receive your blood glucose monitor, and you'll have an appointment with either a diabetes educator or a GP after that. In the meantime, we've sent you some resources to get you started and information on where to get help. There are some common concerns women express. It's normal to feel overwhelmed or that gestational diabetes is unfair, worry what it means for you and your baby. Hopefully this presentation puts your mind at rest that you can manage this and will be supported to do so. Taking steps to manage it is the best thing you can do for yourself and your baby. To summarise, we've looked at what causes GDM, management tools, expectations and potential complications, and hopefully given you reassurance that you'll be supported to get through it. Just do your best. Thanks for listening to this presentation and best of luck with the remainder of your pregnancy.